You'll need to stay right by the mic, Dr.
I have a long list of things that I'd like answered, but you're probably in as good a position as anybody to know the complexity. I would like to suggest one additional thing to your tort reform consideration, and that's somehow to weed out the difference between, we have to differentiate between a bad outcome and negligence.
Absolutely right.
And we have so much problem when we do have bad outcomes thinking that somebody must be at fault, because we in this society are now expecting perfection, and we're not ever going to get it. But the one thing that I really was interested in hearing your comments, and you pretty much just finished on your last comments addressing that, and that has to do with we pledged allegiance, and the last phrase is with liberty and justice. And I think most of our fears that we see happening relate to injustice and lack of freedom. And we see things happening and so that's what we're reacting to. That's our fear.
Where do you see it in this bill or other things, Doctor? Share with me what you're concerned about.
The freedom, that wasn't my point, but the freedom comes when we don't have choice. And when you get a big, mammoth bureaucracy, you don't have choice. They can't treat you as an individual. I'll give you an example. We run multiple ambulatory surgery centers. We have to conform to the rules and regulations. Even though we simply do eye surgery, we have to conform to the rules and regulations for every ambulatory surgery center. Orthopedics, OB, GI, multi-specialty. We have to have for example, a signed agreement, a written contract with a radiology group that's approved by Medicare. Even though we have never, in 25 years, ordered a single X-ray.
Doctor, separately I proposed, I think we ought to have a Department of Stupid Laws. And I'm being serious, honestly. I think we ought to have an opportunity where citizens can, and I hear these stories a lot, and we ought to be able to report, and then every year in the Congress we have an omnibus bill to remove or correct stupid laws. And this would be a candidate. I really believe that.
Last week we had a site review, and we were cited in our surgery center where the inspector saw one of our RNs take 2 Tylenol out of a big bottle, put it in a cup, get a glass of water to the patient, pour the pills into the patient's hand because they had a headache just before surgery. We were cited for that because it's not in the jurisdiction of an RN to redistribute pills. We have a bureaucracy. We have a huge disconnect with people making rules and regulations in bureaus.
Absolutely.
And this is driving up the cost of care incredibly.
And every profession and every industry can share with us countless of them.
My son got cited by OSHA when he was painting. He was up on a ladder. This was a few years ago. He was up on a ladder in our office, summer work. He was painting. The ladder was tethered properly. Everything was proper. He was wearing shorts. He was cited for wearing shorts. So we have stupid things. Anyway,
you had other questions. Go ahead.
Yeah.
We need to wrap this up.
Okay, real quick. I'm concerned about injustice. I think sometimes we're made to feel like we're the bad guys. I think we're the good guys. We do everything right. We're responsible. We raise our kids. We pay our taxes. We vote. We go to church. We contribute to charity. But then we do all of these things, and when other people who don't live the same lifestyle don't follow those same principles, we are asked to bail them out. Necessarily just about people who might be living in poverty. I'm talking about corporate executives who make stupid decisions. And they are never held responsible.
Thank you, Gordon. We need to get to the next speaker. Thank you so much.
Next speaker.